Management of acute renal failure. Management of acute renal failure. Acute renal failure is acute and sustained following glomerular filtration rate associated with the loss of security function and the accumulation of metabolic work products and water.
Kidneys are organs in the body. They're located in the back, and they're about the size of a fist. And they're the organs that help filter the blood and help you get rid of toxins.
They function to get rid of excess fluid, excess water, excess salts and poisons that accumulate in your body as you eat and go through everyday life.
Filtered waste and fluids are collected in the bladder and eventually leave the body as urine.
African Americans and other minorities are more likely to get diabetes, which is the #1 cause of kidney failure in the United States and now probably the world. Other risk factors for kidney disease include hypertension or high blood pressure, protein in the urine, polycystic kidney disease, and a family history of kidney disease.
And so people can see their doctor and get that information early and know what their blood pressure is and control their diabetes, and that decreases the progression to kidney failure.
Okay, here we go. And then one day, my body told me, I'm going to stop you. I'm going to stop you from doing this because you're trying to kill me, so I ain't going to stop you. The next thing I knew, I had this situation where as
Application in medicine. Renal replacement therapy. In a USA, renal replacement therapy can be categorized of continuous of intermittent. In the UK, continuous therapy predominated. They are free randomized controlled therapy comparing intermittent with continuous therapies, but continuous renal replacement therapy is associated with reduced mortality. Indication for starting renal replacement therapy. It is better to start renal replacement therapy early, wait the complication to develop. Fluid balance is major stimulus starting in scarcely is parent because large volumes in daily intravenous fluid are required to maintain interval volume and for that daily and nutrition.
There are three key concepts necessary to the understanding of renal replacement therapy: diffusion, dialysis, and ultrafiltration. Diffusion is the movement of solute from an area of high concentration to an area of low concentration by random molecular movement. Dialysis is diffusion across a semi-permeable membrane. Molecules still move down a concentration gradient, but it allows selective movement so that smaller molecular weight molecules can pass across the membrane, while larger molecular weight molecules are retained on one side of the membrane. Ultrafiltration is the principle underlying hemofiltration. Fluid is forced against the semi-permeable membrane by hydrostatic pressure. Low molecular weight.
Type of continuous renal replacement therapy. Continuous venous hematophiltration is the most commonly used and generally continuous process. Cellular of not clear rapid but over continuous period of clear efficiency. Pros and cons. Pros and cons. Diffusion is used for removing small word molecules. Convertation sometimes revolve host solving traits in the use to remove both layers and small well molecules. Infiltration use positive per curve of the blood sign of the membrane of negative pressure on the fluid side in the membrane confluence to move it out flight.
talk about the results of the renal trial. The renal trial is a large multi-center randomized controlled trial that investigated the role of different intensities of treatment in the management of acute kidney injury in critically ill patients. So the findings of the study contradicted the findings of the Lancet study, and this study is of course a higher level of evidence because the mortality outcome was more clearly defined. This is a multi-center study. There was data verification, data monitoring, and the conduct of the investigation was of the highest degree.
Diseases. Acute renal failure. Acute renal failure is a common complication on critical illness which is associated with high mortality and has a separate influence after the risk of the death.
Hi, my name is George McKenzie. I'm not a doctor, but I have had a lot of kidney problems through the years, and I've learned a lot about the different types of kidney disorders. So I've created this video to help anyone who may suspect they're developing a kidney problem and would like to learn a little bit more about this topic. Acute renal failure may be caused by problems in the kidneys themselves, but could also result from a wide range of other disorders and conditions that occur elsewhere in the human body. Before discussing acute renal failure causes further, let's take a moment to define exactly what acute renal failure is.
Kidney failure. Acute kidney injury, also called acute renal failure, means that your kidneys have to stop working. Thanks.